Hello, my name is Matthew. I'm going to be a nurse for today. We're going to be doing a head-to-toe assessment. Do you have any questions about that?
No.
Okay, could I get your name and date of birth?
Ben Johnson, 01, 06, 03.
Okay, can you tell me where we are, Ben?
We are at the hospital right now.
Alright, and can you tell me today's date within the hour?
04/22/2021, and it's about 7 o'clock p.m.
Very good, Ben. Alright, patient is alert and oriented. We're going to move on to Perla. If you can have you look straight ahead, I'm going to measure your pupil diameter. Your left pupil is 4 millimeters. The right is 4 millimeters as well. Pupils are equal in size and both round. I'm going to test your direct consensual light reflexes. Direct, consensual, direct, and consensual. Direct and consensual light reflexes are both intact. If I could have you look off into the distance when I hold my pen up, look at my pen. Very good. Eyes are accommodating as well. Alright, we're going to move on to your extremity strength. If I could have you hold your arms out like this, push up against my hands. Very good. Upper extremities are equally strong bilaterally. Strength is 5 out of 5. If I could have you push up against my hands as well with your legs and pull back. Lower extremity strength is equally strong bilaterally. I would rate that a 5 out of 5 as well. Moving on to respiratory system. Patient's posture is erect. The breathing appears to be effortless, and the chest shape is ovular. AP to transverse diameter is 1. AP to transverse ratio is 1 to 2. And we're going to observe their extremities for any signs of edema. Nothing here. Nothing. Making sure to apply pressure over bony prominences. Observing for any edema. No edema. If I could just have you put your hands out like this. Nail beds are pink and show no signs of cyanosis. Capillary refill in less than 2 seconds on the right hand. Capillary refill in less than 2 seconds on the left hand. Again, no signs of cyanosis. Nail beds are pink. Moving on to the feet. Toes. No signs of cyanosis on both toes. Nail beds are pink. And capillary refill in less than 2 seconds on the right. Capillary refill in less than 2 seconds on the left as well. Okay, moving on. I'm going to palpate your chest. Let me know if you feel any pain or tenderness here. Any pain or tenderness? Alright, if I have you raise your arms. Any pain or tenderness with that?
No.
Alright, move on to your back. Let me know if you feel any pain or tenderness with this. Anything?
Nope.
Alright, if I could have you take your shirt off now at this point. Observing the chest for any lumps, bumps, or lesions, anything like that. Nothing at all. No scrapes. Skin appears to be pale, no signs of arrhythmia. Alright, moving on, we're going to listen to your lungs. And when I move my stethoscope to a different spot, if I could have you inhale and exhale. Inhale. Very good. Good, moving on to your side here. Inhale. Other side. Inhale. Very good. If I can have you face that way, I'm going to listen to your back now. And to your lungs. Breathe in. Very good. No signs of rales, crackles, or wheezes were present at any point in auscultation. I'm now going to do the respiratory expansion test. If I could have you breathe out and breathe in. Very good. Both my thumbs moved out there, which shows that there's no signs of a collapsed lung or anything like that. Patient passes the respiratory expansion test. Alright, I'm going to auscultate your carotid artery now using the bell of my stethoscope. If I could have you hold your breath. Okay, you can breathe now. No signs of any buoy or turbulent flow. If I could have you hold your breath again. And now you can breathe. Again, no signs of buoy or turbulent flow. If I could have you lay down now, this way for me. Now going to auscultate the heart, moving hip to man. Starting with the aortic, I'm going to go on the second intercostal space by the sternal border on the right side to listen to the aortic valve. Very good. Second intercostal space on the left side, the pulmonic valve. Down one intercostal space would be Erb's point. Down to the fifth intercostal space by the sternal border would be the tricuspid valve. And the midclavicular line, fifth intercostal space, would be the mitral valve. Very good. S1 and S2 sounds were heard. S1's louder at the apex, S2 louder at the base. Now I'm going to listen to the apical pulse for a minute and count the heart rate. Good. No signs of abnormal heart rate, no murmurs or anything like that. Heart rate was 69 beats per minute. Alright, now I'm going to palpate pulses, starting with the carotid. Pulses are equally strong bilaterally. I rate them as a 2+. Moving on to brachial here. Again, pulses equally strong bilaterally. I would rate them as a 2+ as well. Radial. Equally strong, 2+. Femoral, which I would normally do below the clothing, but for the purposes of this video I will not. Equally strong, 2+. Popliteal. You can relax. Equally strong, 2+. Posterior tibial. Equally strong, 2+. And then the dorsalis pedis. Equally strong, 2+. All pulses are equally strong bilaterally, rated as a 2+. Moving on to the abdomen, I'm going to inspect the abdomen. No signs of any lumps, bumps, or lesions, no arrhythmia or cyanosis. Stomach is flat, and after that we're going to auscultate. Auscultating twice in each quadrant with the diaphragm. Vowel sounds were heard in all 4 quadrants. Each time, I would rate them as active. Moving on, we're going to percuss again in 2 spots in each quadrant, starting in the upper right quadrant, moving clockwise. Dullness is expected in the upper right quadrant, which I just heard because the liver is there. So, tympany is heard in the upper left quadrant and both of the lower quadrant. Liver dullness is heard in the upper right quadrant. Alright, I'm going to move on to palpation now. Palpating twice in each quadrant again, starting off with light touch. Any pain or tenderness with that?
No.
Let me know if you feel any pain or tenderness at all here. Anything?
No.
Okay, now we'll move on to deep palpation. Any pain or tenderness at all there?
No.
Very good, I'll help you up here. And that will conclude this full body assessment. Thank you.